Hi, my name is Paula. I'm here to talk to you about care plans. Today we're going to learn how to initiate a care plan, how to add a care plan, how to edit and update a care plan for your shift, how to resolve a care plan, and also to go over care plan review. First, we're going to go over how to view care plans in different ways. So for this patient, as you can see, there's a lot of care plans already here. If you expand the window, you can see the titles of all of the care plans that are already here. To see the care plans in the expanded form, you would click Properties and choose under Initial State of the Care Plan Expanded and click Submit. When the screen refreshes, you'll see that all the care plans are open. So you don't have to individually open all of the interventions and problems within each care plan. To see only active care plans, click Active Only. Now I'm going to initiate a care plan. I'm going to click the Add button with a green circle and a plus sign. On the care plan drop-down, I would click that and choose the care plan that I would need. I would either type it or choose it from the list. So for now, I'm going to choose blood transfusion risk for injury. I'm going to choose a target date and time. For the target date and time, that is the date and time that you would expect the patient to fulfill the goals and the interventions in the care plan. So I'm going to choose April 20th and I'm going to keep the time. Priority, I'm going to choose it as the first priority. Status is active, and you would scroll down. Right below barriers, comments, date and time, there's a drop down. I would choose care plan has been initiated, and then I would hit submit. Now sometimes you would run into this error message that the care plan is already added. So that means the care plan already exists. So you would click OK. It is most likely that that care plan is already in the patient's account and is resolved. So you have to make sure that that resolved is turned into active so that you could see it when you hit active only care plans. So I'm going to go ahead and find that care plan that I want to turn into active. It's right here, blood transfusion risk for injury, and it's resolved. So what I'm going to do is click on the title and click active. Make sure the target date is within the correct admission date. So I'm going to do it for April 20th. Put in the priority and choose to initiate that care plan. So go ahead and click submit. We want to make sure that you're individualizing your care plans according to your patient's care. So we have some care plans that have pediatric interventions in them. So if your patient is not a pediatric patient, please delete them, and you can do so by right-clicking on the title of that care plan and clicking delete. Now it only shows the adult interventions for that care plan. You can add individual comments or resolve interventions by clicking the intervention. Make sure you put an order priority and a Cardex group. This doesn't matter what you put into it because we don't use electronic Cardexes. Your status, we would put resolved. And you can also add comments about the patient. Patient completed this intervention and or goal. Then you would click submit, It's reminding me to select a priority, which is something that's needed. And when you go back to that care plan, under that an intervention, it should be not on your list anymore. If you want to resolve the care plan, you would click on the care plan's title. Under status, on the right side, you would change the active to resolved. And then you would give a reason why the status changed. The patient was discharged. And then you would click submit. Now you'll no longer see that resolve care plan, and you can only see that when you click entire plan. According to CMS, we are required to involve our patients in the development of their plan of care. So in some of our interventions in the care plans, you can comment, for example here, work with the patient and family on learning diversional activities. You can put in a comment section within the intervention. Down here, encourage patient and family to provide input in their plan of care. Just a short, brief comment that we did involve them in their plan of care on development of care plans. So when you click submit, you need to put in a priority. So under that intervention, we can see and we can show any surveyor that we provided the opportunity for the patient to provide their input on their plan of care. Also, if a surveyor asks you for any information about the care plans and the history of the care plans, you would click print. It will render the PDF. And as you can see, they can see the comments that we made for certain interventions under the intervention that we worked on. Patient was involved in the development of their plan of care. And that's how we would fulfill that. Currently, we have an issue with patients who have a length of stay greater than 100 days. You aren't able to update the care plans at this time, so our contingent plan is using Care Plan Review. So Care Plan Review is the tab right next to Care Plans. You would click that. Then you would click Add. And then under Care Plan Problems Reviewed, I would click the green circle with the plus sign. I would pick the care plans that are I am unable to update, and I would click submit. And then on the notes, I'm going to type, I have reviewed and updated these care plans. For now, this will be the plan for these patients who we cannot update care plans for. Guam Memorial Hospital is changing the way they do discharge planning and multidisciplinary plan of care. As of now, there are not a lot of changes for nursing, but in the future there will be. For general admission, nursing will answer the trigger questions and will identify high-risk patients needing discharge planning, and we'll go over the category of high-risk patients later on. After that, those triggers get sent to different members of the interdisciplinary team, which are the ancillary departments, for consultation and assessment. Now, after that, the interdisciplinary plan of care must be initiated by the admission nurse or other members of the interdisciplinary team if they get to it first. After that, an interdisciplinary plan of care, or what we will be calling it, multidisciplinary plan of care, weekly meeting will be done by the team. And recommendations for that, for the plan of care for the patients, will be inputted into a multidisciplinary plan of care team recommendations note, and the physician has to sign it. So these interdisciplinary or multidisciplinary weekly meetings will be tracking down not only the plan of care for the patient as a whole, but as well as discharge planning. When we are making recommendations in those weekly meetings that we have to make sure that we take care of any discharge planning needs for the patient, as well as any needs that they have for plan of care. This is the category of high-risk patients for discharge planning. Patients who are 80 years and older, patients who lived alone prior to admission, patients with poor family support, homeless prior to admission, greater than 5 comorbidities, history of home oxygen use, history of hemodialysis outpatient, new or continuing, new onset history of CVA with 3 or more functional area deficits, motor, visual, and cognitive, dependent in greater than 50% of ADLs, patients who are bedbound, admission to hospital with home-acquired pressure injuries, signs of neglect or abuse, acute hospital admissions due to fall, multiple hospitalizations in the past year, greater than 5 complex medications, catastrophic injury, new diabetic, receiving anticoagulation, has 5 to 10 prescriptions, patients who have MI, COPD, stroke, or CHF, or patients with core measures deemed by CMS as patient at great risk for readmission. We will be incorporating this documentation into your shift assessments and your general admission.